Doctors from the Potchefstroom and the Witrand Psychiatric hospitals have downed tools, and they are currently demanding to meet with North West Health MEC Madoda Sambatha. Now, this after a protest had turned ugly just yesterday with rubber bullets fired by police and a private security company. eNCA reporter Nqobile Madlala has been following this story and joins us now with more information about exactly what are some of the grievances from healthcare workers. Nqobile, good morning to you. What are some of those concerns raised by workers this morning?
Ultimately, a lot of workers that we spoke about corruption. They said that there are issues that are in the hospitals, and the two hospitals that they're worried about, that they would like the MEC to look into. Things like they're saying that some of the monies have been sent to people based on what kind of relationship you have with management. This, of course, are allegations that the minute that the MEC did say that they will be looking into. But one of the major issues, which is what a lot of people were really unhappy about, was also the fact that they were not getting their performance bonuses. And of course, they were saying that they've put themselves in line, that they've put their lives in line, their loved ones as well under COVID, that they deserve this performance bonuses, and they wanted this to happen. And they were saying that there was selected few that got it, and they got to a point where they really needed this, and so they went as far as now looking into getting the MEC to intervene because they felt that they were not being heard by management. Of course, it did turn ugly. We got to a point where the police were shooting at some of the people that had come at the time. I mean, there was a lot of numbers, but we heard from the MEC that the reason also was that he wanted to speak to the leaders and not necessarily to all the people that had come, and the agreement was that they were going to speak to the leader. But I want to bring in one of the leaders who has been here and, of course, has been speaking to some people on the ground. Maxwell, we spoke yesterday and we were marching. That was before the shooting started. First of all, I just want to get an idea, how is everyone feeling today in understanding that they haven't been at work on an unprotected strike?
I suppose everyone today must be feeling a little bit excited by the fact that the MEC, there are some remarks on Facebook somewhere whereby he understands that where do we come from, and the people are expecting the better response from the MEC today so that we end this action.
When you say a better response, what exactly is that?
A better response is which means is going to respond to the employees that everything will be sorted out in a right way. That is what we are expecting for the MEC today. I suppose he met with managers yesterday. He knows most of these issues the employees are complaining about. He must be giving us a way forward. How best can we resolve all these issues today?
And say the MEC does decide otherwise, what will happen?
If the MEC decides otherwise, we'll have to replan what is it that we need to do so that we resolve these problems. I am just hoping that the MEC understands our issues. Our issues are genuine. We're not looking for something which is not doable. All our issues are doable.
All right, and do you want to just highlight those doable issues?
The doable issues are the means of getting those people who were denied bonuses, their bonuses. Our issues is to do away with asbestos buildings, which is also a problem. Our issues is to do away with corruption, which is taking place in the Department of Health. Those are some of the major issues we are crying for, and we also problematic with the leaking roofs in both institutions. When it's raining, it's even worse when you are supposed to go to work, knowing that the workplace that you are going to is raining as well. And then you are wearing a uniform, the members of the community will be telling you you see your people, your place is not good and all those things. You feel embarrassed by such circumstances. I suppose he must tell us, he is going to tell us that the plans which are there for fixing those leaking roofs in both institutions are supposed to be implemented now.
All right. Thank you very much, Mr. Maxwell. Well, there you have it, Dumelo. They're saying that they've got quite a lot of issues, also touching on those asbestos roofs, he's saying. He's saying that there's also leaking roof in the hospital, which is quite something that is concerning as well. He says they feel embarrassed having to deal with the community members that also has their views with regards to how the management or how the public sector works. But I just want to show you, so this is what was happening yesterday. It's still like that, still not cleaned at this morning, but we are seeing some of the leaders come in at this point. We've seen some of the numbers coming in, so people are still mobilizing, coming into Witrand Hospital. We've also seen the security at this point in this morning. We've also seen them, they're just on the other side, the same security that they had a bit of an issue with. So, I mean, at this point it looks like it's calm. We, of course, will see during the day as to what will occur. And if the MEC, just like what he said to Dumela yesterday, he said that if he finds that there are people that have crossed the law or have done things wrong, he will make sure that there will be a sense of accountability. So we are going to find out if that happens today, because he also promised that he was going to speak to the police and find out why were they shooting at the workers. So those are some of the points that we are waiting to hear from the MEC once, of course, that meeting is done.
All right, Nqobile Madlala, we'll be sure to come back to you as soon as those responses and answers are given by the MEC. But thanks for this update, colleague. That's eNCA reporter Nqobile Madlala.